Hello and a very good afternoon to all of those joining me on the Newsline digital page. I'm Neha. The United States Food and Drug Administration has issued a warning to pregnant women, asking them to avoid taking common pain relievers like Advil and Aleve for the last 4 months of pregnancy over a possibility of harm to fetus. Now, this comes after the prior warnings which cautioned against its use from the last 3 months of pregnancy to the last 4 months. The FDA, while issuing a forewarning to the people, said that the drugs can cause a rare but serious complication that may lead to harming the fetus by causing kidney issues that may result in low levels of amniotic fluid in the womb. However, the regulator said that the warning does not apply to low-dose aspirin. Dr. Petriza, who is the acting director of the FDA Center for Drug Evaluation and Research, said women should understand the pros and cons of the medications they're taking during pregnancy. She says, and I quote, "It is important that women understand the benefits and risks of the medications that they may take over the course of their pregnancy. To this end, the agency is using its regulatory authority to inform women and their healthcare providers about the risks if NSAIDs are used after around 20 weeks of pregnancy and beyond," quote unquote. Now, to understand more about the topic, joining me over the phone line is Dr. Aruna Muralidhar, who is a gynecologist in Fetus Hospital. Thank you very much, Dr. Muralidhar, and a very good afternoon to you.
Good afternoon.
My first question to you, Dr. Muralidhar, would be how often are Advil and Aleve prescribed for pregnant women in India? And if they are common prescription drugs, shouldn't this ring alarm bells?
Absolutely, Neha. So Advil and Aleve are more of a American brand. The same brands are not available in India as commonly, but there are other brands which do have the same composition, which is ibuprofen and naproxen.
All right.
So, and moreover, combination medications are also available, which contain other painkillers along with the naproxen and ibuprofen. So it is important that we also, identify these brands and issue a similar warning in India, because Advil and Aleve are specifically, mentioned in the American sort of market.
Mm-hmm. All right,
Dr. And of course, yes, alarm bells should ring.
All right. Dr. Muralidhar, in India, what are the pain-relieving medications given to pregnant women, and, have they been known to cause any of the side effects?
Right. So, as obstetricians and gynecologists, we are quite aware that these NSAIDs, the so-called NSAIDs, which are non-steroidal anti-inflammatory drugs, are ideally avoided in pregnancy. They have various problems in pregnancy, so they are to be avoided, essentially. Mm-hmm. So the other alternatives that we generally use, which are safer, are paracetamol-based and what we call opioid-based. But we try and avoid the NSAIDs as far as possible in pregnancy, unless the risks, the benefits outweigh the risks completely.
Mm-hmm. So you're saying there are no complications attached to these medications?
No, there are complications attached to these medications.
Mm-hmm. And what would be those?
The alternatives is paracetamol, which are safer. So the complications associated with non-steroidal anti-inflammatory drugs are quite a few. In the first trimester, they may cause a miscarriage. And all through pregnancy, they may even cause a certain amount of vaginal bleeding and hemorrhage. And specifically in pregnancy, on the baby, they have this effect of causing oligohydramnios, which means that the fluid around the baby, which is produced by the placenta, tends to reduce, and that may cause issues with the baby's development as well. Also, the kidney of the baby, the fetal kidney, tends to get affected as well. And if used in very high doses, the mother's kidney also may get affected and may even lead to acute renal failure. The other issue, which is when taken in the third trimester, which means the last 3 months of pregnancy, and especially the last few weeks of pregnancy, it can cause premature closure of what we call a ductus arteriosus, which is a very important artery when the baby is inside the womb to maintain the circulation. It usually closes after birth, but it may close prematurely if these medications are used in the last few weeks of pregnancy. Mm-hmm. So there are quite a few issues with the use of these. They even reduce platelets and cause excessive bleeding as well. So there are quite a few risks which may be very dangerous to the baby if used in the pregnancy. Mm-hmm. So essentially they have to be prescribed And if they are prescribed, if they are really required, they have to be prescribed in the lowest dose possible and for the least number of days required. And that's very, very important for not only obstetricians and gynecologists, but anybody who is dealing with pregnant women to know, including general practitioners and other specialties as well.
Dr. Muralidhar, how do these drugs really work? What we understand is that these are among common pain relievers, but if these medications have to be substituted, please tell us about a few good alternatives that are available in the Indian market.
Certainly. So NSAIDs, as far as possible, we want to avoid them. But if somebody is, having very severe pain issues which have to require NSAIDs, then we use them in that particular situation only for the shortest period required. But the other alternatives, as I said earlier, are paracetamol, which is quite safe in pregnancy, and opioids, which are a certain set of drugs which reduce the pain as well. And opioids also can be prescribed, and these are definitely not over-the-counter medications. They have to be prescribed by a health professional and prescribed again very carefully, considering all the other implications. So NSAIDs in pregnancy generally can be avoided most of the time, and they're generally used for non-pregnant women for other issues like severe arthritis and many other pain conditions and sports injuries, etc. But we can do without the NSAIDs in pregnancy. But aspirin being a kind of exception, because aspirin in a certain amount, like 75 milligrams up to 150 milligrams, although is an NSAID, is used safely in pregnancy for various problems related to pregnancy.
Right. Dr. Muralidhar, what we understand is that these medications are the most commonly used in the United States. But you're saying that there are various complications attached to it. So how does it work if, on one side, these are the most commonly used drugs in the United States?
No, they are commonly used for various pain relief requirements for non-pregnant women.
Okay.
But pregnant women generally, in India especially, we're very wary of using NSAIDs. So we generally don't prescribe Advil or Aleve or similar kinds of medications which contain naproxen, ibuprofen, diclofenac, even celecoxib, etc. So we try and steer away from these prescriptions, in pregnancy especially. And as a gynecologist and obstetrician, and I definitely tell my pregnant ladies that as soon as you find out you're pregnant, do make sure that you don't take any over-the-counter medications, including sprays like Volini spray, which is, there are some brands which are quite common, which contain diclofenac in them. So I try and ask them to avoid using too many of these sprays as well, because not only are the tablets containing these medications, there are some certain ointments and gels and sprays which also contain these medications.
Right.
And if they are used, to a large extent, they can cause trouble as well.
Right. Thank you very much, Dr. Muralidhar, for joining us with all of those important updates. Well, if you're not sure about the kind of medication you're taking, it's always advisable to consult your doctor and then go ahead with it. Thank you so very much for joining me. If at all you like the information that I've just shared with you all, please don't forget to subscribe News9 Digital. Like us on News9 Instagram, Facebook as well as Twitter. Thank you very much for watching. Stay safe.